Welcome to the OR Today webinar series. We're excited to have over 150 registered attendees for today's webinar. And I want to take this opportunity to remind everyone that our 4th annual OR Today Live Surgical Conference will be held August 26th through 28th in Nashville, Tennessee. So do make sure to plan to save the dates. Details are available online at our website, which is ortodaylive.com. As always, we want to award an OR Today prize pack to today's first attendee that can tell me how many theaters are on Broadway. Use the questions featured now on your webinar dashboard to answer. While you're answering this week's trivia question, I want to remind you that today's webinar is eligible for 1 continuing education hour. To obtain your certificate, you must complete the post-webinar survey, which will appear immediately on your computer screen at the end of today's presentation. If you do not receive the survey, you can email us at webinar@mdpublishing.com, and I'll remind you of this information at the end of today's call. All right, let's see who today's winner is. Congratulations to Tammy Rawls. You're the winner of our OR Today Live prize pack because you knew the correct answer was 40 theaters on Broadway. Our presenter today is Phyllis Quinlan, president of MFW Consultants and a successful nurse entrepreneur. As a certified transformational personal or career coach, Phyllis specializes in the unique needs of nurses and other professional or family caregivers. Phyllis, you may begin whenever you're ready.
Thank you, Jamie. Good afternoon, everyone. I think the first and most important thing I want to share with everyone this afternoon is to know the rules of dealing effectively with bullying and incivility. Rule number 1, do not go it alone. This is such a multifaceted issue, and it crosses so many human resource lines, policies, and procedures that to try to deal effectively with it on your own as a middle manager or even a director of a department is ill-advised. You need to collaborate with human resources, upper administrative management, the executive management of your organization, and of course, the managers of the department or the unit where the issue is arising. So unless you have the collaboration of all three, I would not proceed. It could really reflect eventually on your professional and personal reputation and open you up to all sorts of liabilities if you don't do it as a cooperative effort with administration, human resources, and of course, you. So we all know that unfortunately nursing has the reputation of eating its young, and it's probably, had that reputation that goes as far back as Florence Nightingale. We are now seeing a lot of things pop up into the literature that talks about the impact of bullying behavior. From an individual standpoint, we're looking at certainly stress. We're certainly looking at anxiety around going to work at all. What we're seeing is individuals suffering from what would be called post-traumatic stress disorder symptoms. I would certainly call it compassion fatigue symptoms. Certainly anxiety, which could lead to disruptive sleep, loss of self-esteem, which of course then could lead to depression. You certainly will then have some of your most promising people engaging in job searching. But I think probably the most dire individual consequences of the impact of bullying behavior is that the person who is being targeted will choose isolation as a form of coping. In other words, they will absolutely start to close down their compassionate nature and heart. They will come to work, they will do their job, they will seem extremely robotic. They're going to be rendering care from their head and certainly not their heart. And that would really be a sin, because if anybody needs people, it's nurses. By definition, we are people who need people. If you are seeing or observing any of your staff, especially your newer staff, starting to engage in isolating behavior where they're not taking breaks with anyone, they're coming to work on time, appear on time, seem very, very robotic, have no desire to be engaged in collaborative care committees or anything outside of exactly what they need to do. Just a heads up that person might be the target of bullying behavior. From an organizational perspective, we know that bullying leads to lower staff engagement, which of course will always lead to lower productivity, lower job satisfaction, little to no commitment in any organizational goals or objectives, initiatives. You're certainly going to see higher absentee rates followed by higher turnover rates and greater uses of healthcare. And we know that it's going to be reflected in so much more. In the fall of 2016, I was able to crisscross the country offering a program like this to raise awareness about bullying and incivility. And the program was targeted, the audience was executive and middle managers in the perioperative world. And by and large, when I took a very informal mini census, or opinion poll, if you will, what we determined was that about 85% of our staff show up every day ready, willing, and able to do their job. They come with a good attitude. They want to give world-class care to the best of their ability. They want to act in a civil manner. They just want to do the best they can. They want to derive personal and professional satisfaction from what they're doing. And they are, to a degree, the silent majority. If we accept that number, then it leaves us with 15% that we certainly agreed on engaged in what we would call disruptive behavior. Within that 15%, everyone acknowledged that about 10% engaged in what we would call chronic uncivil behavior. And I'll get into that definition a little bit more clearly as we go forward. But if 10% of the 15% of the disruptive behavior is engaging in chronically uncivil behavior, what we agreed upon then was that the remaining 5% are really our true bullies. And what was agreed upon is why, if there was a 5% spike in any clinical indicator within our department, if there was a 5% spike in skin alterations, a 5% spike in postoperative infections, a 5% spike in any nurse-sensitive indicator, we would have a plan in place to address that effectively within an hour or less. But we really have an issue now where we have an issue of bullying that we pretty much agreed only takes on about 5% of our staff. And yet we seem extremely challenged about being able to put our arms around and that particular 5% problem and deal with it effectively. So I want to create awareness, begin to create an awareness into the insight of the personality of a bully. And I think the best definition of a bully comes from Louis Maltby, who is the president of the National Works Rights Institute. At least his definition closely aligns with mine. Workplace bullying is persistent, offensive, abusive, intimidating, or insulting behavior or unfair actions directed at another individual, which causes that individual to feel threatened, abused, humiliated, or vulnerable. Now, clearly, no one should be going to work under the umbrella of feeling that there might be an opportunity or at some point during the workday where they're going to feel threatened, abused, humiliated, or vulnerable. I am often asked, is bullying intended? And I'm going to tell you, yes, it is. And the Joint Commission also substantiates that bullying is indeed an intended behavior. There is some literature out there. Back in 2006, Lewis observed that bullies are fully aware of their actions. And there was corroborating evidence in that in the literature from Stevenson and company, which also studied some of the bullying behavior that was directed towards nursing students. And it was absolutely intended behavior, and there was a signal that was given to the students where the students actually thought this was almost like rites of passage, that, they'd have to tolerate the bullying as part of, the ability to fit into the organization, hazing rights, if you will. Before I go into my definition of bullying, I just want to give a quick review of Psychology 101. not something we often deal with in the perioperative world. We have two great categories within the psychological setting, and one is, patients who would fit into the diagnosis of psychosis. And we know that psychosis, unfortunately, is a situation where the person is no longer tethered to reality. They hear things we don't hear, they see things we don't see, they act upon information that is only given to them. And, they really have a very loose connection to the here and the now and what the rest of us would consider real. The rest of the population falls under the category of neurosis. And, if you're wondering what a neurotic person looks like, just simply look to the person to your left or right, because there they are. By and large, most of us fall under this category. I like to say that neurosis is the definition of being human. All of our quirks, our characteristics, our little foibles, the things that are part of our nature and our character, the things that give us charm, so to speak, really come under the heading of neurosis. Unfortunately, for lack of a better term, we can say those people who suffer from psychosis are indeed crazy. Not the best term, but for today we're going to use it. Those who are neurotic, though, are not crazy. They tend to make themselves a little crazy and perhaps make themselves, others a little crazy, depending upon their behavior. But they are very tightly woven to reality, maybe a little too much so. Under the umbrella of neurosis, there is a subset called personality disorders. And the number one personality disorder is narcissism. I really want to discuss this today, and it's really the focus of what I want to share with you, because it is my belief that a bully in healthcare is essentially a narcissist with a license. So this definition, or these characteristics of narcissistic behavior, come from the American Psychiatric Association. Narcissists by and large have an exaggerated sense of self-importance. They believe that they are special, and you better too. Expect recognition without achievement that warrants it. They believe that they are superior, and that they can only be appreciated by equally superior people, which is probably why your bullies leapfrog you in your chain of command, especially if you're in middle management, because a middle manager isn't important enough for them to address their concerns with. They have to go directly to a director or even a vice president, because after all, that person is worthy and can probably better understand what the points that they are making. So leapfrogging the chain of command on a consistent basis, even with restructuring or restating of structure, is one of the hallmark signs that you're dealing with a narcissist. They require constant admiration. It's almost like you have to welcome them and have a round of applause that they showed up at work. Sense of entitlement, absolutely. Having the inability or unwillingness to recognize the needs of others is also hallmark. It's not that they are unable, it's just that I honestly believe they don't have the gene. They just don't seem to be able to make the same type of connection with another human being that a non-narcissist would be able to make. They are envious of other people and believe people are envious of them, and of course, they are arrogant. People with narcissistic personality disorders are just very dismissive. If you try to reason with them or share with them that their behavior made someone, feel vulnerable or, abused, they will turn that around as to the victim being at fault for that. Well, that's their problem. That's not my problem. They need to toughen up. These are the kinds of comebacks that you usually hear. Unfortunately, what all of this bravado covers up is a very fragile self-esteem. They certainly have a lack of sensitivity to others. They will abuse special privileges, which unfortunately they seem to have a lot because they are usually very knowledgeable and very skilled. It's not unlikely that we put them in positions of charge, or that they do rise up the leadership ladder from time to time. We also tend to use them as preceptors because they are so knowledgeable and skillful. And I would encourage you to rethink that. If you know that they're going to abuse their special behaviors, and we are trying now to keep, our newest staff members, therefore our most vulnerable staff members, safe. You know, you may want to sacrifice having somebody who can actually connect with that person on a human level, be the preceptor, as opposed to someone with knowledge and skills. So knowledge and skills can come over time. You know, driving, you know, the abuse that can come from a bully certainly will drive somebody out the door quicker, and you're just, you know, throwing your orientation money out the door with it. One of the things that you really must appreciate in order to stay safe yourself is to know that a narcissist will react very aberrantly to criticism. They take it extremely personally, where you and I might take feedback for what it's worth, or, you know, we may turn around and say, well, there might be some truth in there I can learn from, and okay, you know, it's not the easiest criticism. No one wants to hear a criticism, you know, but perhaps there's something I can use here to improve myself. A narcissist will not react that way. Of course, you know, a narcissist will think that nothing needs improving. Therefore, you are now threatening them. So any kind of criticism, feedback, whatever, is going to be viewed as a threat. Therefore, they are going to react angrily. They are going to feel the need to retaliate. And here's what separates the narcissist from just about everyone else. They will now be on a mission of revenge. I say this to you because I want to restate here and now again, do not go to try to manage successfully bullying behavior on your own. When you are dealing with someone who is compelled to be angry, compelled to retaliate, and compelled to develop a plan of revenge, you don't want to be dealing with that person alone. You cannot outthink a narcissist if you're not one. And certainly, you know, you don't want to learn how to, but you do need administration, human resources with you in order to develop an effective plan. They're very good at playing the victim card, so that they're bullying, and now if you are not in a fully, you know, bought into plan about how to deal with this person effectively, then they're going to turn it around that you are the aggressor and that you are indeed bullying them, and they will play the victim card quite skillfully. The secret weapon of a narcissist, there are several. They are often quite smart. They are often quite skilled. This is their stock and trade. We kind of think once or twice about, you know, disciplining them or removing them or doing anything with them, because we often feel that we need their knowledge and skills for the department to work effectively. And this is their stock and trade. You know, what would we do without them? You know, we start questioning ourselves. And quite honestly, you know, I think we've come to a point now where, you know, the need for a healthy work environment far outweighs the need for any one person who perhaps is quite smart or quite skilled. They like to be on committees because they like to be informed, not that they share that information, but they usually insist that they're on some of the more crucial committees in the organization. But here are some of the secret weapons. They are cunning, and they can talk over you, through you, around you, and almost convince you that you're the crazy one, that you are misinterpreting facts, that you are, you know, you're being misled, and you find yourself questioning your own good judgment when you're dealing with these folks. They can be quite slippery this way. But the real scary piece here is that they do possess predator skills. They are able to seek out who is the most vulnerable on the unit before they decide to just be a bully. If you notice your bullies, if you really sit down and take a look at your bullies, it's not one size fits all. They don't go after everybody. They really only go after those that they feel that they can be successful with, which is part of a predator nature. They carve out the weaker person, or the person they believe might be weaker from the pack. I've never met an ugly narcissist. It really doesn't go with the term. They're usually attractive, not necessarily handsome and gorgeous, but definitely attractive. They can be very charming when useful. And they can also be very seductive. If you have got them in a place where they have to kind of say, you know, well, I'll try harder, or, oh my God, I really didn't realize that. You know, they're going to tell you what you want to believe. They're going to tell you what you want to hear. They're going to find a charming way, a very seductive way to get out of an awkward moment. And you're going to believe that, you know, they're really going to give it a very good professional try going forward. And quite honestly, you're getting suckered into pushing the finish line with them further than perhaps you might want to. So it's time now at this point to realize that what we have here, one of the reasons why bullying thrives in a caring profession is that bullies do need people who are more than willing to be helpful, that are more than willing to be understanding, who are more than willing to push the finish line further. They need people who will give and give some more and give until it hurts. So it is my belief that bullies who indeed are narcissists with license, really thrive in a caring behavior because we are codependent in our need to be needed. They appeal to us as, well, maybe you can help me. Maybe, if you just believe in me one more time, if you just give me another chance, I can certainly, be everything you want me to be. And it triggers our caring, compassionate nature. And it lures us into being codependent the same way codependency can happen in alcoholism or in substance abuse. So we have to confront this in ourselves. If you've ever found yourself making an excuse for a staff person, if you've ever found yourself making an excuse for a preceptor, if you've ever said to a new staff member, listen, I'm going to put you with Phyllis today, but she can be a handful, but if you keep your head down and your mouth shut, you can learn a lot. If you're doing public relation work for staff members, then you are engaging in this codependent behavior that I am speaking of, and we really do need to reel that in and stop. So I'd like everybody to make a personal pledge today that the next time someone shows you their true colors, that you don't try to repaint them, that you realize who and what you're dealing with, and that you don't let your caregiver personality blind you to what's actually going on and blind you to the fact that you're dealing with a narcissist who will never change. And I know nurses, that's heresy to nurses to hear that. They always feel that if they try a little bit harder and, employ a different technique or a different method, they can fix a problem or perhaps a person in this particular instance. But I assure you, this is not a fixable thing. The only true way to deal with the 5% of our staff that are engaging in bullying, narcissistic behavior is to craft a plan that you document effectively to eventually get them to the door. And if you're dealing with someone who has more than 5 years experience in your organization, you are looking at least 12 to 18 months of consistent documentation in aberrant behavior before you can pretty much sit down with human resources and they will partner with you to do the deed of exiting an individual. It shouldn't be easy to terminate someone, okay? It shouldn't be easy. You should have to do the documentation that it takes to say to this person, you can no longer be employed in this organization. So, I do support the fact that it takes as long as it does to do the documentation. But remember, at the end of the day, when you do the documentation, again, 15 to 18 months worth of consistent documentation, it's not because your leadership failed, it's because that person made a bad choice. So let's just switch now for a minute to the characteristics of those staff members who are what I would say chronically uncivil. This is the 10% of the disruptive behavior that we see at work. Chronically uncivil individuals are irritating, they're childish. Their disruptive behavior does not leave everyone feeling threatened, humiliated, or vulnerable. It usually has everyone annoyed, aggravated, frustrated, but it is not something that devastates an individual. Chronically uncivil behavior is, chronically late for work, chronically late for giving, report, or for relieving others for breaks, lunch, or at the end of the shift. They have poor boundaries about discussing their personal challenges. They have chronic complainers. They can suck all the energy out of the room. I mean, even if it's a bright, sunny day, they can just make everybody feel poorly. Inappropriate body language at huddles and meetings, real childlike behavior. If you're in management or an executive area, uncivil behavior could mean chronic cancellation of meetings. Everybody's day is busy, and if you're chronically canceling meetings and having to require people to constantly reorganize their day or their week, that's uncivil behavior. Other uncivil behavior by leadership could be always going to your go-to staff. You know, everybody needs to pull their work equally, and I'm guilty of this myself. Rather than arguing with someone and having to explain to them and engage in a discussion that is exhausting, you know, you certainly just go to your go-to staff and ask them to do the special, you know, assignment or you know, maybe an extra 4 hours or come in on what was going to be a day off. It's just easier to do that, but easier doesn't make it civil behavior. Chronically interrupting people who are talking or talking over someone, inappropriate reactions when in resolution of problems, stomping feet, leaving, getting up out of meetings, slamming hands on desks or tables. You know, all of this childlike behavior really comes under the umbrella of irritating, disruptive behavior that's chronically uncivil. But when you look at some key assessment points comparing your bully to that person who's chronically uncivil, when we're talking about insight into their behavior, if you sit down and you talk with somebody, you try to have them be insightful into what they are doing, how they are perceived, and the consequences of their behavior on the team, a bully will absolutely have no insight. They just can't, they don't get it, and they're never going to get it. All right, so don't try to keep showing it to them. Where someone who is chronically uncivil may need some coaching assistance, they need some training, but eventually they're going to understand that they are, you know, really shooting themselves in the foot, and they are indeed their own problem, or, you know, the biggest part of the problem. As far as being able to sustain any plan of action to correct behavior, a bully cannot sustain any plan of correction. They will promise you the moon, and you will believe them, or they will at least try to get you to believe them. You might give them 1 chance, 2 chances, however many chances, but it'll always come back to some reason that triggers their behavior again. And of course, they will not own that. They will say it's because of this, it's because of that, this person did this person did that, but they are just not able to sustain any promise of adult-like, non-disruptive behavior. Whereas the person who is chronically uncivil, again, they can sustain it. It might take time, but you're certainly going to see steps of improvement followed by steps to being able to sustain what the plan of action or the plan of correction is. A bully will not follow a chain of commands. You're not, you know, if you're the middle manager or the charge person, you're not important enough for them. So they will leapfrog you and go directly to directors and VPs or executive directors. Think nothing of going up to someone at a conference and just starting to, you know, engage in a conversation. It's really amazing. The person who is chronically uncivil will follow the chain of command. Occasionally, if their impulsive behavior gets the better of them, they may break structure, but they can be easily corrected, and they will, once structure is restated. A bully will seek revenge. If they see you as a threat to them, if you are onto them and they know it, and you are a threat now to what they perceive as their survival and a threat to their sense of importance, they will develop a plan of retaliation and seek revenge. The person who is chronically uncivil has the potential to do that, but usually will think twice. They have some boundaries and usually don't want to have the consequences or don't feel powerful enough or strong enough to enact a plan of revenge. So I think it's, you know, fairly apparent to most people that workplace civility truly matters. We know now that your staff engagement scores and maybe your patient satisfaction scores will suffer if we don't have a civility, you know, a civil atmosphere and a healthy work environment. Certainly, it will impact productivity. It will impact, you know, just the overall atmosphere on the unit. Patients will pick up that there is tension between work groups. It will interfere with communication. People don't read emails, or they miscommunicate to one another. It makes it harder to retain your employees. It certainly is not going to, if you're using purposeful rounding to try to make good engagement with patients and staff and colleagues, Certainly, if you don't have a civil or healthy workplace environment, that's going to be a very, very difficult goal to attain. And it really does interfere with the transfer of institutional knowledge. If there's any new initiative or any new training that needs to go on, when people aren't working well together and you're laboring under an unhealthy work environment, getting that done or reaching that goal is nearly impossible. So what we're really coming down to is, civility starts at the top, and it really does start with an atmosphere of respect from the top down, and then, of course, equal respect from the bottom up. And, people in positions of authority need to be visible and accessible. You have to keep keep the timelines, no chronic cancellation of meetings. You must recognize the contributions of others and acknowledge that. You want to develop opportunities for everyone, all right? Not just the squeaky wheels and not just your favorites, all right? But everybody needs an equal opportunity for professional development. They also, need to have expectations for a standard of performance for everyone. If there is a double standard or a perception that there is a double standard of performance on the unit or in the department, certainly that is going to create a very hostile atmosphere. And again, resisting going to your go-to staff. And I think probably the worst thing anybody can do to a professional adult is to not give any kind of feedback. Whether feedback is constructive or not constructive, ignoring someone is probably the worst insult that you can give them. So really everybody, under your leadership needs to have some constructive feedback, not just at the time of the performance appraisal, but on a regular routine basis, and an opportunity for mentoring and coaching that can promote their personal and professional growth. So what we're really looking for here is to create an atmosphere where we're all acting like adults, as silly as that sounds, where adult-like behavior is demonstrated by respect for everyone, by people behaving in a restraintful manner, in other words, having good self-management skills, and everybody just being polite or having consideration for the next guy. It's not difficult to create an atmosphere of civility. It just has to be very plain spoken and stated, and then, of course, role modeled, that this is what we expect, and if you cannot maintain this, then you can't be in this department. So the challenge of creating a culture of civility is right here. And, if we don't really put all our forces and energies behind this now, I just don't know when we would do that. As I said, unfortunately, the reputation of eating our young goes back to Florence Nightingale. And I'm really hoping that, it will come to us now to really address this. So let's talk about building some de-escalation skills. Right? If you've identified the person on your team that's the narcissist, all right, and the bully, now what? Well, the first thing, of course, you're going to do is to have a sit down with administration and human resources and have it, develop a plan. And, what's going to happen. And it's probably going to involve the beginning of the continuation of the documentation of disruptive behavior. And again, we're looking at least 12 to 18 months and more for those staff members who are more long-term employees of an organization. But one of the things that you want to make sure that you don't do, right, is you don't ignore what's going on, all right, that you call out the behavior, not publicly, but you are sending a consistent message to that person that you're putting light on that behavior, because as I call bullying behavior shadow behavior. It usually happens in the dark or in the shadows or in the corners of the department. We need to start saying, I see this, and we're not going to be ignoring it. Please don't go it alone. Again, administration and human resources is the other two absolute vital pieces of the partnership here. But don't go it alone in the sense that you need to reach out to your trusted colleagues, probably outside of your organization, that are going to support you. Please don't take what's going to happen or the bullying, piece personally, because quite honestly, the bully doesn't know how else to behave. So whether it's you or someone else, this is not personal. This is just business for them. So even though it's going to feel personal and they're going to target things at you that are going to try to trigger you, don't take it as a personal affront. And this way you'll stay more in command of yourself and your reaction. No retaliation. Please don't isolate yourself. All right. And, the more firm you understand that this is impersonal, this is just how they do things, you'll be able to be stronger as this person attempts to control or disparage you. What you do want to do is inform, again, your administration, and human resources. And if you're in an organization where labor is involved, human resources should be touching base with labor, be the liaison for that person, for that team as well. You do want to set boundaries, although boundaries for a narcissist are tough to keep, but you do want to keep setting them and reinforcing them. You do want to avoid and minimize your availability. So if you've had an open door policy up to this point, you can maintain it, but not for this person. And this person will disregard that. They will make every attempt to find you in the cafeteria, in the hallway, coming out of the restroom. They will nag and hound and nag and hound because one of the traits that they have is that nagging. And what they will do is try to wear you down so that you either cave in, give up, or change your mind. And you cannot let that happen. So limiting your exposure to them is important. Building and reaching a support network for yourself, seeking external support for yourself is very needed. Make sure you take good care of your health at this point. And then you do want to practice your response for those times when they are trying to make some kind of verbal statement like, you're always aggressive towards me. I can't do anything right for you. Whatever their claim is, you want to have a few mantras in your hand or in your bag, so to speak, that you can give right away that is given in a tone of voice that is professional but sincere. So if someone, in a large, with an audience around them says, I can never do anything right for you. You always seem to be on my back. Instead of engaging in that confrontation, you simply turn around, look at them, and in a normal tone of voice say, I'm sorry you feel that way. And then you turn around and you walk away. This is called cognitive rehearsal, okay? Having an understanding of what you might need to say at those all-important moments. Griffin demonstrated this in 2004, that teaching cognitive rehearsal was really a very good way for newly licensed nurses to be able to manage some of the bullying that came from the more seasoned staff. So, we all do this. We all have significant others that, in our personal life, wait till my wife or my husband comes home, or wait till those kids come home, and you're going to say something, and you're rehearsing it in your head, and you really want to use that time to blow off that, those emotions and that extra adrenaline, and to be able to craft a response that, when needed in a very crucial moment, sounds crafted, has a beginning, middle, and an end, is given in a normal tone of voice, and allows you to be professional and not triggered. But again, once you've answered it, you turn around and you walk away. You don't stick around to be engaged in any kind of discourse or confrontation. Certainly nothing that's going to be presumed as putting on a show for everyone. Use what you've learned at work as far as team steps are concerned. The De-escalation model works well. Describe the situation when you're doing just-in-time coaching with this person. And again, just-in-time coaching is going to be done privately. You can just describe what's going on, express your concerns, suggest alternatives, and talk about consequences. And this also makes a very nice template for you to do your documentation. If you have something like this on a template in your computer, then after you do this crucial conversation with someone, you can go in and just put a few bullet points under each heading, print it out, sign it, put today's date on it, and bam, you've got the documentation for that close encounter. And again, the consistent documentation of disruptive behavior or your attempts to deal with that disruptive behavior is going to be very crucial in the eyes of human resources and administration. Another model that's accepted is the SFED model, which is your for feedback. If you have to give feedback, you ask the person for their self-assessment first, try to get some insight into their degree of self-awareness, and then you give your very objective feedback. You can give them some encouragement. I know you can do this. You know, you keep trying. I'm sure you can do this, whether you believe it or not. That's what you're saying. And then, of course, you give your direction or your coaching for what they need to do the next time this situation happens. Again, this can make a very nice template for documentation. Just put your self-assessment, feedback, encouragement, direction headings on a piece of paper, and when you go into your office, then you can put a couple of bullet points underneath to summarize and memorialize that coaching session or just-in-time coaching session that you did in private with someone, and that documentation is then done very neatly, swiftly, and effectively or efficiently. But there absolutely has to be an appreciation that anybody who tries to go it alone or deal with bullying and incivility without the aid of human resources is going to probably wind up in a bucket of hot water. And they will have nobody to blame but themselves. I cannot stress this enough. There are all sorts of human resources laws that you probably are unaware of that you will probably have to navigate here. And unless you have your human resource professional with you, you could really wind up having this backfire on you, no matter how well-intended your motives are. But when we are collaborating with administration and human resources, I really am hoping that we can get to a point where we're not talking about so much new hires or onboarding people when we hire people and when we interview people. But I'd like, because we're talking about a culture of civility and a culture of caring so often, that if you are hiring or promoting, that what you're really doing is extending an invitation to join our culture. And that person then has to demonstrate the ability for good citizenship into that culture. And if they are going to engage in disruptive behavior, whether that's incivility or bullying, that would be seen then as organizational defiance against that culture. And I think if we come down and really realize that, you know, during orientation we talked about a culture of civility, we talked about zero tolerance for workplace violence, whether that's lateral or horizontal, but we really do need to stress that any departure from this very important feature of culture means that you are really forfeiting your citizenship or your right to be a member of that culture because you are demonstrating organizational defiance. What's really sad here is that we know that, you know, the episodes of bullying, especially bullying, not so much incivility, but bullying, is perpetually underreported. And it's really of great concern. The Joint Commission is coming out with all sorts of standards now. In 2016, they came out with, you know, a white paper that really discussed the link between having an unhealthy work environment where bullying and incivility were rampant and the connection between that and poor patient outcomes and errors. The Emergency Nurses Association, the American Nurses Association, all of the associations are really coming out in support of this. So, you know, again, the time is now. When you are collaborating, you know, I feel that one of the ways that we can put a little more teeth into our zero tolerance policies is maybe if the ANCC, the people responsible for Magnet and the Pathway to Excellence, really started to weave more standards that addressed incivility and bullying into the Magnet journey or the Pathway to Excellence journey. And that those reports of bullying and incivility need to be handled by human resources and only human resources. And that, you know, any kind of complaints need to be presented during the time of Magnet survey. I think, you know, we would see a little bit more action around this, a little bit more determination, because we all know that at some point our organization probably deserves to be Magnet, but certainly would want to be on a journey for Magnet. We need to craft our interviewing questions differently, you know, so that we can get a little bit more insight into narcissism. I always suggest that people, when people talk about, you know, tell us what you've been involved in, listen for the word I as opposed to the word we. People who are narcissistic tend to use I an awful lot, even if they're talking about a group project. A little tip is I often ask a candidate who I've made like a 10 o'clock appointment with for an interview to wait a few minutes. My secretary will say, gee, something's come up. or can I get you a cup of coffee? Do all the niceties and politeness around making someone wait maybe 10, maybe 15 minutes or so. And then when I do bring that person in, of course, I apologize profusely, sit down, and I take a look at their attitude. The person who is, going to be the good team player is like, well, gee, if this isn't a good time for the interview, I can come back, or I certainly understand you need more time. I have all day. I can wait. They're going to demonstrate team attitude right then and there. The person who's the narcissist is going to be very aggravated that you made them wait. It's just a real clue right then, there, and now that, this is maybe a person that you do not want to consider going forward with. I am a big proponent of the 6-month probationary period as opposed to the 3-month probationary period. I do feel that, someone can kind of maintain a facade for 3 months, but usually they can't maintain that same facade for 6. If we've all dated somebody, in our personal lives who was terrific for 3 months, and then, the next 4, 5, 6 months, they turned into somebody else. So, I think the longer the probationary period, and I think 6 months is probably the one to go with, the better chance you have of really understanding how this person will be a team player and really add to the overall healthiness of the workplace environment. You want to make sure that all of your policies and procedures, again, when you're collaborating with administration and human resources, especially if you are in organizations that have multiple sites or you've undergone a lot of mergers and acquisitions, you want to make sure that you have common language. Sit down with the committee and make sure that the definition of bullying is the same in every policy, procedure, protocol that you have, that there's nothing here that can be misread or misconstrued or interpreted for someone else's benefit and not for the organization's benefit. So, clear definitions about what bullying is and isn't, and clear definitions about, with examples. And the American Nurses Association has come out with a list of examples of what they believe is indeed bullying behavior. If your bullying policy does not have a no retaliation clause, it's probably not worth the paper it's written on. There has to be something in there that says that you cannot retaliate against the person bringing a complaint. That certainly an investigation is going to happen, and we're going to corroborate these facts, but there cannot be retaliation, and that the person understands if you do retaliate, that you're looking at almost immediate termination. So implementation really is around training. We certainly train a lot. And usually we train on all these important policies and procedures annually, and I'm suggesting that you do it every 3 months if you're really looking to get the word out there that it's a new day and civility will be the order of that day. When you're doing an investigation, good to follow the acronym LISTEN. Okay, you want to lean into the situation. Don't put this off for the last thing you need to do that day. Try not to be judgmental about the situation and the event. Stay curious. If somebody's if you're interviewing someone and you always want to interview certainly with another person, and hopefully that person's from human resources, you just want to stay curious. Your mantra here is tell me more, tell me more. I always like to think of the word wait, why am I talking? If you're doing the interviewing and you're trying to get information, you should not be doing the talking, you should be doing the listening. Solving the problem at that point in time is not your job. You are information seeking. You're going to take copious notes. Of course, human resources is involved. And if anybody asks you to share an opinion, you're going to decline that. You just simply say to them, we're in the fact-finding stages here, and it would be inappropriate for me to give an opinion at this point. But if we're looking at long-term solutions, I put to you that the long-term solution here is really developing emotional intelligence competencies in ourselves as leaders and within our staff as well. We've come to a time in our collective caring professions where skills and knowledge is no longer enough to ensure a commitment to a culture of caring, and certainly should not be the only thing that we weave into a performance evaluation. That the new benchmark and the new competencies are the competencies of emotional intelligence. People who have good emotional intelligence are they're self-motivated. They're naturally friendly. They can focus on things. They have an ease about them. They seem seem to have good work-life integration. They have a sense of self-control. They have a sense of freedom about them, and freedom in the sense that, you know, if you want to put a protocol in place because there's a state or federal mandate, that they're not going to give you an argument and a song and a dance about why do they have to do this. You know, so if the Department of Health says you need to wash your hands for 15 seconds 1 year, and 2 years later they turn around and say you have to wash your hands for 20 seconds, this is not an argument or something that causes, you know, a major discourse. Okay, fine, I wash my hands for 20 seconds, no problem. They're just generally content people who seem to appreciate small things in life, where the person with low emotional intelligence or emotional quotient has a pervasive fear of loneliness. They're constantly frustrated. They just seem to be bitter. They're always acting like they're a victim. You know, there's no energy about them. There's a lack of effigy, you know, there's a lethargy about them. They just constantly are perpetually disappointed. Everything's an obligation, you know, which I really feel comes from just a pervasive sense of unresolved fear and frustration. People with high emotional intelligence have good judgment and discernment. They keep things in perspective. They're sensitive to themselves, but they're sensitive to the needs of others. They have real courage, you know, not just toughness about them, just courage. They show good self-restraint, and they are indeed patient when patience is called for. While someone with low emotional intelligence is constantly going around with the mantra, if only, you know, if only I was taller, if only I was, you know, this, if only I was that, if only I didn't marry him, if only I did this, you know, and then they want to say, and then I would be happy. Really, the situation here is they're looking for happiness outside of themselves, where people who have, you know, really good honed emotional intelligence realize that real joy and happiness comes from within. You're never going to find it without. So really what we know now is that your intelligence quotient, your IQ, is a potential for how much you can learn, and it's pretty much fixed at birth. And right now we know that it's only responsible for 20% of your success in both life and career, where it's really how well you can manage yourself and how well you can manage your relationships that are going to affect your personal success and your professional success. So Daniel Goleman, who is the guru for emotional intelligence, describes emotional intelligence as managing emotions well in ourselves and in our relationships. That's about as simple a definition as you can get, and it really does hit the mark. He identifies 4 competencies as the hallmark competencies of emotional intelligence: self-awareness, self-management, social awareness, and social skills, or what I like to call relationship management. Self-awareness really is being in touch with your own feelings so that you know how they affect you, and more importantly, how they affect others around you. The 3 subsets of this are: do you have good emotional self-awareness? Are you aware of how your emotions fuel your behavior? Are you aware that under certain circumstances you consistently or habitually act in a certain manner? We call these things triggers. Are you able to assess that in yourself? Do you have good assessment skills so that you know what you need to work on for personal development? And do you have good self-confidence? Not self-confidence in the conventional sense, but self-confidence in the sense of, do you know how you affect others? Are you the person who walks into a room on a bad day and everybody turns around and says, oh, thank God? Or are you that person who walks into a room on a bad day and everybody says, oh God? In other words, the last thing we need at this point in time is this one walking into the room, because they're only going to add to the problem. How do you affect the people around you? Are you part of the answer, or are you part of the problem? Self-management, the best definition I ever saw of self-management is the ability to act with intent. In other words, you can decide how you're going to react in a given situation. You are not going to be fueled by unbridled emotion. I'm going to go, for the sake of time, I'm just going to quickly skip over to, the subsets within self-management, which are emotional self-control, being trustworthy, conscientious, adapt to certain circumstances, certainly having an optimistic attitude, and the initiative to be a self-starter when it is called for. Social awareness is really the ability to recognize and appropriately respond to the emotions of others. And, you know, once you have the competency of self-awareness and self-management honed, and you're really, really strong in these two competencies, your ability to be more empathetic and understand how other people feel, and therefore be more compassionate about how you work with other people, just seems to naturally come from that. So that we're looking at people with good self-awareness being empathetic, having good organizational awareness, and certainly having the ability to be service-oriented. And then finally, social skills, which is really, you know, all the transformational leadership skills that we talk about in the literature. You know, it refers to a proficiency of obtaining desired responses from people, not because they have to, but because they want to. Because people will line up to be working on your team in your department with you. So, and this means that you're proficient at developing others, that you inspire people, that you are more concentrating on influencing a situation as opposed to having power over a situation, that you're an effective communicator, someone who can really manage change, you can resolve conflict, build bonds, and really anchor teamwork and promote collaboration. So when we're talking about bullying and incivility and turning a blind eye, we're really, are we going to really say that we want a culture of civility going forward? This particular quote came to mind. The highest courage is to dare to be yourself in the face of adversity, choosing right over wrong, ethics over convenience, and truth over popularity. These are the choices that measure our lives, whether we are staff or whether we are leaders and managers. We need to travel the path of integrity without looking back. So there really is never never a wrong time to do the right thing. And I think if we collectively put our shoulders together and decide that we deserve to be able to work in a healthy work environment and we partner with administration and human resources, we can actually achieve that. Are there any questions?
Great, Phyllis. Yes, we have quite a few questions that came in, but I always like to remind the attendees you can submit a question anytime. We're going to try to get through as many as we can. I know we've reached the 60-minute mark, but Phyllis, first question, how would you suggest someone begin the discussion about addressing bullying and incivility with administration and HR?
Well, I would absolutely make the appointment. This is not something that you want to have casual. You want to make a formal appointment for the discussion. You want to come down, you know, to that meeting with some facts and documentation in hand. You really need to talk about, you know, and not just subjective pieces, but actual events, and then talk about how, you know, clearly how, you know, the environment that this is producing is either threatening your Press-Ganey scores, your staff engagement scores, or even your quality indicators as far as errors are concerned. So the more you can come in with that and talk about how, if we can, you know, develop, you know, an agreed upon structure around how we're going to handle this person so that we speak with one unified voice, even though we know it's going to take the better part of 2 years to do the documentation on this. I think you can really sit down and start that crucial conversation and get their buy-in.
I had a follow-up question of an attendee that chimed in while you're answering that one. If I'm an independent contractor, could I still go to HR?
That's a tricky question, and it's a really good one. I would think that you would have to speak to the leadership of the organization with which you're coming into that organization. In other words, you are an independent contractor, therefore not an employee of the organization, but an employee of the agency or firm that you are representing. I would start with them and you know, have some documentation there. You might be very surprised to find out, if you talk to the administrator, the owner of your firm, that they are looking to build a file because clearly they can't meet the organization's needs for staffing because of an unhealthy work environment, and then that outside contractor can have that crucial conversation with the organization, and that might spark an investigation that can lead to some good resolution.
Great, and I have quite a few attendees asking if they can get a copy of the presentation. Just to let everyone know, we always record our presentations. This webinar recording will be posted on ortoday.com/webinar within the next 24 hours. If you needed more information than the recorded webinar, you're welcome to contact Phyllis. But Phyllis, another question came in. Is there any remedy for narcissism?
No. The short answer and the only answer is unfortunately no. And I know that's so very, very difficult for professional caregivers to hear. And we have been trained, our instincts, our DNA, everything about us says, there has to be some remedy for this. But no. In order for someone to change their behavior, they first have to sincerely acknowledge that their behavior is problematic and that a change is necessary. A narcissist is going to tell you what you want to hear to buy themselves time, but they don't believe it. And because they don't believe it, there's really no need for them to change. Their expectation is that they will be accommodated, that everybody else around them will accommodate them because they, unfortunately, believe they are the center of the universe.
Here's a great question that came in as well. What if the issue you're having is with someone that's on the leadership or executive team?
Yeah. You're going to have to take a breath, and you're going to have to make sure that you start taking some notes for yourself, kind of reverse the documentation process. Where you can actually and very objectively talk about, whether you have an unfair assignment or an unsafe assignment, or you're the go-to person, or you feel you're being spoken to harshly, or you're being reprimanded in public, whatever the issue, the heartburn issue is there. I would start taking some notes, some dates, some times. Was there anybody witnessing this before I made the appointment with Human Resources? But at some point, and it's only you who will know that, you're going to have to make that appointment with Human Resources in order to effect a change.
Let's see if we can get through two more questions. What is the D4 and SFED?
I'm sorry? What is the D4?
What is the D4 in the acronym SFED?
Okay, so it's described. Okay, so it's, I believe you're talking about SFED. Correct. Okay, so it would be ask for the person to reflect. So what did you think about that encounter, or how do you think that went? You're going to ask for their self-reflection, their self-awareness piece. You're going to explain to them then very objectively what the issue is. You give them feedback, very objective feedback. Explain to them why that particular approach wasn't working. And D is describe the consequences. All right. So, if you continue to behave in this manner, we're going to have to do this, this, and this. But be very careful about talking about consequences. Only talk about consequences you can truly enact. That's why partnership with HR is so very vital.
I agree. That's great insight. Last question I think we have time for is, can you please review again the type and amount of documentation needed to make your case?
Excellent question, and thank you for asking it so that I can really be clear here. You don't have to write War and Peace every time that you are documenting on someone who is either exhibiting uncivil behavior or bullying. You just have to memorialize the event. That's why I like the use of templates, so that you can just kind of stick to the facts. You need to talk about what's been going on, again, depending on how long-term the employee is. So if the employee is there less than 5 years, the documentation may only need to be 6 to 9 months. If they're there more than 5 years, it usually is 12 to 15 months, perhaps even a little bit more. But your documentation should include a very consistent message that is memorialized in coaching and counseling conferences, going up the progressive discipline chain, which is, of course, a verbal, a written. I don't know if you do 2 written before you do a suspension, whatever the case may be in your organization. It also should be rich with attempts to offer the person training, so that, you know, if somebody's having trouble communicating and there's a stress management class they can go to, or how to communicate effectively, or anger management, or something where you're offering them opportunities to gain insight into habitual behaviors that are no longer serving them, you want to weave that kind of documentation into that portfolio as well. But you want to have a portfolio on someone that's rich enough that you can sit down in front of HR and kind of say, in the beginning, here's what we did, and they were not able to sustain the corrective action, and then we did this, and everything was fine for a couple of weeks, but then here's what happened. And, you know, you may even want to put this into some kind of spreadsheet for someone, so that, you know, the spreadsheet along the top would pretty much talk about the types of people who were involved in the bullying events, whether they are colleagues, vendors, physicians, families, you know, whatever. And then, you know, down the other side of the column on the, you know, other side of the page, talk about, you know, the dates and times when this happened, so that when you put these, you know, we put this remediation in after this, and then the person has an event happen with the physician, and then we put this other information or remediation in place, and then they acted out against a family member. You know, when you put it on a spreadsheet, it's almost undeniable. In fact, people look at the spreadsheet and say, oh my God, how long has this been going on? And then, you know, you're looking at them like, come on, you know, this has been going on for a while. Let's not be silly, but let's now take this information and do the right thing with it and make sure that we effectively manage it, because we should be able to effectively manage 5% of any problem within our caring professions and in our healthcare systems. It's just that we are reluctant to take on the issue of bad behavior.
Phyllis, thank you so much. We've gotten lots of feedback from attendees of what a great presentation this was. We certainly appreciate you sharing your knowledge and time with us today. I do want to remind all of the attendees that one lucky attendee today will have a chance to win an Amazon gift card for completing the post-webinar survey. The survey is going to appear on your screen shortly. If you do not see the survey, again, you can email us at webinar@mdpublishing.com. but you must complete the survey to obtain the certificate for the continuing education credit. OR Today is back next month with another webinar. You can see our upcoming presentations at ortoday.com/webinars. Enjoy the rest of your Thursday. I'll see you back next month.